About the test.
We chose to use the Clinical Evaluation of Language Fundamentals, or CEL-5. The CEL-5 is a test designed to assess a child's language and communication skills in a variety of contexts for individuals who are 5 years to 21 years and 11 months old. It helps to determine the presence of a language disorder, describe the nature of the language disorder, and develop a plan for intervention. The CEL-5 consists of a number of tests. Each test is designed to assess specific language skills.
Materials. The Examiner's Manual. The Examiner's Manual presents an introduction to the CEL-5 tests and contains testing information as well as the administration directions for each test, guidelines for recording student responses, and directions for scoring. The Technical Manual. The Technical Manual contains detailed information about the purpose, design, and development of the CEL-5. It also presents the technical characteristics and evidence of reliability and validity of the CEL-5. Stimulus Books 1 and 2. The CEL-5 comes with 2 stimulus books. Each book is spiral bound with an easel and includes tab divider pages for easy identification of the test. These books are part of the administration of the test. The examiner flips the stimulus pages from front to back and the visual stimulus faces the student. Records Form 1 and 2. Records Form 1 is for students ages 5 to 8, and Record Form 2 includes tests for students ages 9 to 21. The record forms contain demonstration items, trial items, test items, and space for recording responses and test results. The clinician must begin the test at the question that indicates the client's age range. If the client does not get the first 2 consecutive answers correct, the clinician must move back to the previous age range. For each subtest, the clinician must stop when the client gets 4 consecutive 0 scores. Kevin is a 13.8-year-old male who will be receiving speech and language evaluation on April 3, 2012 at the Cleveland State University Speech and Hearing Clinic. He is being assessed because of his mother's concerns of delayed language, drooling, and incorrect speech production. Kevin has been receiving speech and language services at Cleveland State University since the summer of 2008 for severe receptive language delay and severe expressive language delay. Kevin was diagnosed with attention deficit hyperactive disorder by a pediatric neurologist in January of 2009. Kevin also presents with weak lip musculature and receives Botox treatments every few months in order to decrease drooling. Kevin's mother requested an up-to-date evaluation to assess his present language abilities.
The Expressive Language Index is an overall measure of the client's speaking and oral expression. The subtests used to derive this score are formulated sentences, recalling sentences, and sentence assembly. Because Kevin has a severe expressive language delay, we chose to show the 3 subtests that make up the Expressive Language Index.
The interview.
Hi, Ms. Garcia. So I'm just going to ask you a few questions about Kevin's language and communication before we give him the evaluation.
Okay.
All right, so can you describe for me Kevin's present communication abilities?
He's able to understand what I'm saying if I keep my sentences short.
Okay.
He usually speaks in adjectives and verbs and very short sentences.
Okay. When did you notice a problem or a delay with his language?
I first noticed that there was a problem when he was about 2 1/2 and he was only saying one word at a time.
Okay.
And it was difficult to understand him. And then I started taking him to speech therapy and he started putting more words together, but his sentences were still short and it was still hard to understand what he was saying.
Okay. Do you notice increases or decreases in his language, like output, depending on his setting or who he's around?
Not really. It seems to be pretty consistent.
Okay. Consistent. Has anyone in your family been diagnosed with a language disorder or seen a speech therapist in the past?
Not that I know of.
Okay. And how does this language delay affect him in school?
He
If at all.
struggles in school.
Struggles.
His teacher said that he has difficulties, especially when he's called on during class.
So his teachers have noticed?
Mm-hmm.
Okay. Okay. Well, thank you. Those are all the questions I have. We'll get Kevin in here and get the evaluation started. Formulated sentences. This subtest evaluates the client's ability to formulate complete semantically and grammatically correct spoken sentences of increasing length and complexity. The client is given a word and an illustration and asked to make a sentence. Okay, Kevin, I'm going to ask you a few questions and I just want you to do your best, okay?
Okay.
So listen carefully to the directions. Here is a picture of people in a library. I will use the word book in a sentence to talk about this picture. The girl is reading a book. Or I could say, a book is on the table. Here's another picture. Now you make a sentence about this picture using the word reading. You must make your sentence about something in the picture and you must use the word reading. Look at the picture to help you think of what to say.
She's reading a book.
Okay. Here is another picture. Now you make a sentence about the picture using the word first. You must make your sentence about something in the picture and you must use the word first. Look at the picture to help you think of what to say.
He's first.
Nice sentence. Now I will say some words and show you some more pictures. I want you to tell me a sentence using each word I say. You must make your sentence about the picture and must use the word I tell you in your sentence. Okay? Okay. Now I want you to use the word when in a sentence and use this picture to help you.
When I ride a bike.
I want you to use the word best in a sentence using this picture to help you.
The girl is the best at dancing.
Nice sentence. Now use the word third in a sentence using this picture to help you.
Him is third.
Now use the word and in a sentence and use this picture to help you.
There is a cat and a dog.
Okay. Now I want you to use the word if in a sentence about this picture.
If they win.
Now use the word before in a sentence.
The man go before the lady.
Now I want you to use the word because in a sentence about this picture.
The car stopped because.
Okay. Recalling sentences. This subtest evaluates the client's ability to listen to spoken sentences of increasing length and complexity and repeat the sentences without changing word meaning and content, word structure, or sentence structure. The client is asked to repeat a sentence after it is read by the clinician. Now I'm going to say a sentence. I want you to listen carefully and repeat what I say. Let's try. My sister is in the 6th grade.
My sister is in the 6th grade.
Listen to another sentence and say exactly what I say. Does Mr. Gomez teach reading?
Does Mr. Gomez teach reading?
Now let's try some more. Remember to listen carefully and say exactly what I say because I can only say it one time. Are you ready?
Mm-hmm.
Okay. The boy bought a book for his friend who likes short stories.
The boy bought a book for a friend who
The book was not returned to the library by the teacher.
The book was not returned to the library by the teacher.
The coach could not find the uniforms that the team wore last year.
The coach could not find the uniforms that the team wore.
Listen carefully. The girl stopped to buy some milk even though she was late for class.
The girl bought some milk even though, I don't know.
Okay. My mother is the nurse who works in a community clinic. Kevin, pay attention.
Mother is the nurse who works in the clinic.
Pay attention. The computers and printers were donated by the school board.
The computers were donated by the school board.
If the rain doesn't stop before noon, the field trip will have to be canceled.
If the rain doesn't stop, it'll have to be canceled.
Okay. Sentence assembly. This subtest evaluates the client's ability to formulate grammatically acceptable and semantically meaningful sentences. The client is asked to manipulate and transform given words and word groups into sentences. Here are some words that can be made into two different sentences. Tall, the boy is. The boy is tall. This sentence tells something. That's one way of doing it. Here's another sentence with the same words. Is the boy tall? This sentence asks something. Now I want you to try it. Make two sentences using the words I show you. Saw, the girl, the boy. Use only those words.
The boy saw the girl. The boy saw the girl.
Can you give me another sentence?
The girl saw the boy.
Here are some more words. Now make two sentences with these words. Is on the chair the kitten.
Is the kitten on the chair?
Now try to make a different one.
The kitten is on the chair.
Now let's do some more. Each time you will make two sentences using the words I show you. Kevin, are you listening?
We're almost done yet.
Almost. Just a few more. Now let's do some more. Each time you will make two sentences using the words I show you. If you need me to, I can repeat each one once. Both sentences must be logical and make sense. Okay? The teacher assigned homework didn't.
The teacher didn't assign homework.
Now make a different sentence.
Didn't the teacher assign homework?
She got, she bought, the job, the car, after.
The car, I don't know.
That's okay, do your best. Here, we'll give you a different one. If it is cold, you'll need to wear a coat.
You'll need to wear a coat if it is cold.
Now try a different one.
If it is cold, you'll need to wear a coat.
The man, the dog, followed by was.
The man was followed by the dog.
Now make a different one.
Was the man followed by the dog.
He finished, he played his homework, hockey, before. Try to make a sentence with those words.
Before he played hockey, he finished his homework.
Now try to make a different sentence.
And his homework, I don't know.
That's okay. Kevin, are you ready? I'm going to read the words. The runner, the race, to win, going, isn't.
He isn't going to win the race.
The keys, the girl, her pocket, put, didn't, in.
She doesn't have the keys in her pocket.
I'm going to read the words one more time. The keys, the girl, her pocket, put, didn't, in. Make a sentence with just those words.
The girl doesn't have the keys in her pocket.
Okay.
After each test is given, the raw scores are added up and recorded on the front of the record form. Then the examiner's manual is used to find the scaled scores, which are also transferred to the front of the form. The scaled score is used to find the core language score. Results of the test. Kevin received an expressive language index score of 61, which is more than 2 standard deviations below the mean. The results show that Kevin has a severe expressive language delay. We would recommend that Kevin also receives an articulation and phonology evaluation because of his mother's concerns of incorrect speech production and his weak lip musculature.
Strengths of the Self-5 are that it is comprehensive and it includes many subtests that can be taken separately if needed. Weaknesses of the Self-5 are that the test takes a long time to administer if you do all subtests, and it requires the use of many materials, which can be distracting for a client.
Thanks for watching.